Hello, welcome to Daily Pathology. I am Dr. Abhishek. So today's topic is reticulocytes. So in this topic we will learn what are reticulocyte, how to calculate reticulocyte percentage, what is its grading of reticulocyte, then reticulocyte production index, corrected reticulocytes and its significance. So let's start the topic. So imagine if a patient with anemia come to your OPD, the real question is not how low the HB of patient is. The real question is the bone marrow of that patient is responding or not. The answer lies in this tiny mature RBC called as reticulocyte. So what are reticulocytes exactly? Reticulocytes are the immature red blood cells. Immature red blood cells released from the bone marrow into the peripheral blood. They still contain residual ribosomal RNA, which can be demonstrated by supravital stains. So two types of supravital stains we use. First is methylene blue and second is brilliant crescent blue. Supravital stains means these stain can stain in living cells outside body. What is normal reticulocyte count? So normal reticulocyte count you must know. For adult it is 0.5 to 2.5%, and for newborn at birth it is 3 to 7%. At day 3 1 to 4%, and day 7 it is less than 3%. So next is what is reticulocyte count? So reticulocyte count tell us the percentage of young RBCs among the total circulating RBCs. It is an indicator of bone marrow erythropoietic activity. So as we learn the normal reticulocyte count, so next question is how to calculate the reticulocyte percentage and what its importance. So reticulocyte percentage is calculated by this formula. So you should learn this formula. This is reticulocyte percentage is equal to number of reticulocyte divided by total RBC counted into 100. So let's see an example. Total RBC examined should be 1000, and reticulocyte observed in that total RBC you calculate 1000 is 50. So reticulocyte percentage by this formula is 1.5%, which is under the normal range for an adult. So this is how you should calculate the reticulocyte. Let's learn on the slide what actually reticulocyte look like, how to calculate them. So this is the microscopic image showing the reticulocytes very beautifully. Look at these. These are the immature RBCs, or also known as reticulocyte, and these are the normal RBCs. So first what you should do, select a field where RBCs are just touching each other, close to each other. Then calculate the normal RBCs in the background. Suppose this field content, overall this field content 250 RBCs, and you have to calculate percentage in 1000 RBCs. So how many fields you should calculate? 4. That is 250, 250, 250 and 250. So in each 250 if you get 25 RBCs, 25 reticulocyte and 25. So you should take that average and then in 1000 RBC and calculate by this formula. You will get a reticulocyte percentage. So this is the classic grading stages of reticulocyte maturation. You should know it is done by Hellmeyer and Westhauser in 1932. So they divided the reticulocyte in 5 stages. So stage 0 to stage 4. Stage 0 is not counted in the reticulocyte percentage. Why? Because this is a nucleated RBC. Nucleated RBC containing a reticulum. So it should not be calculated in our count. Next is stage 1. It is a dense cohesive reticulum. You can see in the image. Stage 2 is the loose reticulum. Stage 3 is the loose reticulum plus few granules, and stage 4 is the scattered granules. So you should remember the staging, and this is not calculated in reticulocyte percentage. Next is corrected reticulocyte count. Why it is important to calculate the corrected reticulocyte percentage can be misleading because the total RBC mass is reduced. Therefore we calculate the correct reticulocyte count, and formula is this: reticulocyte percent into patient hematocrit by normal hematocrit. Example, let's suppose patient reticulocyte percent 6%, hematocrit is 20 and normal is 45, so it is 2.6%. And what is its importance? It gives a true picture of bone marrow response in that patient. Remember this. Next we will learn reticulocyte production index. In severe anemia, reticulocytes are released earlier and stay longer in the blood. So we calculate reticulocyte production index. This is the formula, that is correct reticulocyte by maturation factor. So for this is the maturation factor you should consider. And if RPI is greater than 2%, it means adequate marrow response is there, and if it is less than 2%, then it means inadequate response is there. So lastly, what is the significance of this reticulocyte count percentage, what we discussed earlier? So if there is a high reticulocyte count in patient, it means the bone marrow is responding properly in that patient. So we can assess this in hemolytic anemia, where there is a RBC destruction and marrow trying to compensate by giving more immature RBCs in the peripheral blood. Next is acute blood loss, where is a massive loss of blood in the patient, then should be increased RBC production to compensate. So there also reticulocyte count is increased. Next is decreased reticulocyte count. It means there is inadequate RBC production in the patient, and this is seen in conditions like aplastic anemia, iron deficiency anemia, vitamin B12 deficiency, bone marrow infiltration, chronic kidney disease. So these are the few conditions I enumerate here, but there are more. You should know this. Lastly, what is the take home message from this is, if the patient have low HB and increased reticulocyte, then there is RBC loss or destruction of RBC is going on. Then if there is a low HB and decreased retic count, it means the bone marrow production problem is there in that patient. So thank you and see you soon.